Complete blood count, CBC. The complete blood count, CBC, is perhaps the most commonly ordered laboratory test. Most clinical laboratories utilize an automated methods. Results are usually accurate, reproducible, and rapidly obtained. CBC elements measured usually includes RBC, hemoglobin, hematocrit, mean cell volume, mean cell hemoglobin, mean cell hemoglobin concentration, reticulocyte count, RBC distribution width, white blood cells, platelet counts, and mean platelets volume. The normal range for adult male RBC count is between 4.5 to 5.9 multiplied by 10 to the power of 6 cells per microliter. Females are having relatively lower normal range between 4.1 to 5.1 multiplied to the 10 to the power of 6 cells per microliter due to menstrual blood loss and lower concentration of androgen, which is erythropoietic stimulant. If the patient is having lower RBC count than normal, then the patient is anemic. Hemoglobin is substance available in red blood cells. The normal range for males is between 14 to 17.5 gram per deciliter, and for females between 12.3 to 15.3 gram per deciliter. Hemoglobin is decreased in anemic patients. Hematocrit is the percentage volume of blood which is composed of erythrocytes compared to the total sample collected from the patient. The rest is the plasma. This test is also called packed cell volume. The normal range for males is between 42 to 50%, and for females is between 36 to 45%. Hematocrit is also reduced in anemic patients. Mean cell volume is an estimate of the average volume of red blood cells. It's calculated by dividing hematocrit by red blood cells count. The normal range is between 80 to 96 femtoliter per cell. Based on the result of MCV, the following terminologies are assigned. If it's larger than normal range, then it's called macrocytic. If MCV within the normal range, then it's called normocytic. And if MCV is below the normal range, then it's called microcytic. Mean cell hemoglobin is the amount of hemoglobin per red blood cell. It's calculated by dividing hemoglobin by the RBC count. The normal range is between 27 to 33 picogram per cell. Based on the value of MCH, the following terminologies are used. If MCH is higher than normal range, then it's called hyperchromic. If MCH is within the normal range, it's called normochromic. And if MCH is lower than the normal range, then it's called hypochromic. Mean cell hemoglobin concentration is the hemoglobin divided by hematocrit. The normal range is between 33.4 to 35.5 gram per deciliter. Typically, mean cell hemoglobin concentration results are matching mean cell hemoglobin results. The red blood cells distribution width is the coefficient of variation of MCV, which is equal to standard deviation divided by the mean value. It's an indication of the variation in red cell size, which is called anicytosis. The normal range is between 11.5 to 14.5%. The reticulocyte is the cell form that precedes the mature RBC or erythrocyte. Reticulocytes persist in the circulation for 1 to 2 days before maturing into erythrocytes. The normal range is between 0.5 to 2.5% of RBCs. Since the value is reported as a percentage of RBCs, then in case of reduced hematocrit, then the value of reticulocyte count will be falsely high. To correct for that, reticulocyte index is used, which is equal to the reported percentage of reticulocyte multiplied by actual hematocrit divided by the normal hematocrit. The white blood cell count is the actual count of the number of leukocytes in a given amount of blood. The normal range is between 4.4 to 11.3 multiplied by 10 to the power of 3 cells per millimeter. Total white blood cells count includes polymorphonuclear neutrophils, band neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Erythrocyte sedimentation rate. Erythrocytes normally settle slowly in plasma, but settle rapidly when they aggregate because of electrostatic forces. Normal range for males is between 1 to 15 millimeter per hour, and for females is between 1 to 20 millimeter per hour, and it increases with age. The normal range for platelets is between 140,000 to 440,000 per microliter. The platelet count could be done by automated machines or manually. In most situations, automated methods are more accurate. However, manual methods are indicated in case the platelet count is outside the range between 50,000 to 500,000 per microliter, or when hematocrit is outside the range of 20 to 50%. The normal range for mean platelet volume is between 7 to 11 femtoliter, and it's varied with different laboratories. Clinicians use MPV to differentiate between hypoproductive or hyperdestructive causes of thrombocytopenia.